So I think that we can start now. So again, a very warm welcome to our audience. My name is Marie-Christine Bonamour from Public Safety Communication Europe. I will guide you through this workshop today. We had a record of registration for this topic, more than 450 registrations. Which is really huge, and coming from 40 different countries, so far beyond the European borders, and we are very pleased of that. It is a mix of first responder organizations, academics, also some industry, and organization working with or for disabled person, and we are very pleased to have this representation today. You will see also that to accompany us during this workshop, we have a sign translator with us today. You just saw the short video presenting the project. Public safety is not only tool, but it is also people. People providing assistance and people providing assistance to the population, and sometimes to people with special needs, with disabilities. So today we really want to focus on this topic. I will give you briefly some basic facts only about search and rescue project. The full name of the project.
Yes? in full screen your presentation, you can put it. Sorry for interrupting.
Yeah. So thank you, Anthony. So the name of the project provide already a lot of details about our work. It's about emerging technologies for the early location of entrapped victims under collapsed structures and advanced wearables for risk assessment on first responder safety in search and rescue operation. So the aim is really to enhance the safety and operational capabilities of first responder in search and rescue operation, to develop a governance model integrating innovative tools that should be available at all times, easily accessible, and that will meet stringent requirements in terms of accuracy, quick localization, and reduction of false alarms. The project has started last year in July. It's a 3-year project. It is a large consortium of 28 partners from 12 European countries, among which we have 9 organizations representing practitioners. The coordinator of the project is the National Technical University of Athens, NTUA from Greece. Just a quick word also about who we are, Public Safety Communication Europe Forum. In the project, we are leading the work package communication and dissemination, and we are also active in user requirements and validation of technology. The aim of the forum is really to bring together 3 communities, practitioners who could have unmet needs, limitation in their capabilities, researchers and industry in trying to define together solutions. What is the context of our workshop today? And I think it's very important, and we are really timely with our workshops. Earlier this March, the European Commission has released a strengthened EU strategy for the coming decade, 2021-2030, Union of Equality, a strategy for the rights of persons with disabilities. There is a list of priorities and actions that will be further presented and explained by our next speaker. But we are in a situation here where disaster is identified as a topic of actions for this communication in order to promote equal access on non-discrimination to people and to protect them during disaster. We all know that our society is faced with new and increased challenges due to climate change and has to become more resilient. The dimension of equality should bring some adaptation also in the planning of emergency plans in preparedness, and also during the activity during the disaster. So this dimension should be taken into account during the exercises, during the trainings, should be incorporated in the standards for operations, and should bring new practices. And overall, we should raise awareness about the situation of the people with disabilities. So today we have a very rich program. You have all seen this program. We'll start with a presentation from the European Commission, and then we have a mix of presenters who are either representing organization, working for organization for disabled people, or also practitioners who are incorporating this dimension into their practice in order to improve the response of public safety. So I think it would be a very rich combination of expertise and experience. I will come also to the rules for the meeting today. So for this webinar, the video and presentation will be circulated after the event. You don't have to worry about this. You will be all muted. Please use the chat for your questions. There will be different times for questions. So after each presentation, after each speaker, we can take 1 or 2 questions, but there will be also at the end of the workshop a kind of roundtable live discussion where we can take some more questions. Thank you also to turn off your camera, but I think Anthony already explained that that was taken care of just to improve the quality also of the workshop and the diffusion. So I have finished my presentation. We will move to the first speaker. So Immaculata Planeanza Pereiro is a senior expert in disability and inclusion at Directorate General Employment, Social Affairs and Inclusion at the European Commission in Brussels. And their unit is responsible for the coordination of European policy for persons with disability. And she worked on European disability policy, including the European Disability Strategy for the previous decade, 2010-2020, the EU implementation of the UN Convention on the Right of Persons with Disability, and she's now working on the new strategy that has just been released for the new decade to come. Immaculata informed us yesterday that unfortunately she had very urgent meeting today due to the publication of the new strategy. So she sent us yesterday evening a video that we will pass now that will present this strategy and the activity of the EU in this domain. And then after that, we will move to the different speakers and have the presentation on our topic as well. So thank you, Anthony, to put the video on. Thank you.
Okay, thank you very much for the invitation to present to you the strategy on the rights of persons with disabilities. This strategy has been adopted by the Commission on the 3rd of March this year, and the intention of this strategy is to address the rights of persons with disabilities in the EU policies, including internal and external policies. The strategy is anchored in values that the Treaty of the European Union and the Charter of Fundamental Rights have, and it aims to combat discrimination for persons with disabilities. And also it gets inspiration from the pillar of social rights, particularly Principle 17, and it contributes to building at an Europe of a union of equality in all its senses, as this new commission, has put as one of its objectives. The strategy contains 8 main chapters in areas, and I will explain briefly each of them. And it contains actions for the Commission to undertake, but also the Commission calls on Member States to take some actions, and it contains in particular 7 flagship initiatives to deliver the results of the strategy. The first area of the strategy is accessibility, where the Commission aims to implement in full the legislation that has been adopted in recent years, and to provide guidance to ensure that this implementation is happening in a way that maximizes the opportunities that it provides. To that end, the first flagship initiative that the strategy proposes the creation of a resource center on accessibility that will increase the coherence in accessibility policies and implementation of EU law. It's about providing resources, standards, training, in order to achieve those objectives. It contains specific actions related to different areas, the area of ICT, accessibility, but also passenger rights and mobility and transport, as well as in digital e-governments. The second priority area is about enjoying EU rights, and here we have got two main sub-areas. One, addressing the mobility and free choice of residence by the European citizens, and in particular it's as a flagship initiatives contains the creation of a European disability card that would be recognized across all the member states, so that persons with disabilities can benefit from equal conditions and benefits across when accessing services in different member states. The second sub-area is about participation in democratic participation. The Commission will work with member states to ensure that persons with disabilities can enjoy the right that they have to participate in the democratic process, meaning, for example, voting or being elected. The third area is about decent quality of life and independent living. The Commission will issue guidance recommending to the Member States improvements on independent living and inclusion in the community. It will also present a framework for a quality framework on social services of excellence. The idea here is that in order to ensure that persons with disabilities have the rights, can enjoy the right to decide where to live, how to live, and with whom we live, we need to provide alternatives to residential institutions, so that there are services in the communities, and so that accessibility is a reality on that community. It's also about empowering persons with disabilities so that they have the right skills to find the jobs that would allow them to have that independence, economic independence, and by the way, having a quality job is a good way, is one of the best way of getting included in the community. To that end, the Commission will present a package of measures, of employment measures to improve the labour market outcomes for persons with disabilities. And it will continue to implement the directive on protection from discrimination in the context of employment. Here, some targets will be, the Commission calls on Member States to set targets for the employment of persons with disabilities. Now, to set up a framework of employment that is sustainable and where people with disabilities can have the support that they need, is essential to have adequate social protection systems. And to that end, the Commission will launch a study and guidance to support the Member States in further reform the social protection for persons with disability. The idea is to tackle the gap on social protections between persons with and without disabilities. We have an area now that addresses equal access and non-discrimination. And here, quite a number of thematic areas are included from the perspective of equality. And those include access to justice and legal protection, where a number of actions are included, so that persons with disability has that effective access to justice on equal basis with others. There is also here the issue of protection from discrimination in areas such as social protection, healthcare, education, and access to goods and services. And the Commission there will pursue its efforts to have adopted the proposal that was presented already in 2008 on protection from discrimination. Another area that is being looked from an equality perspective is inclusive and accessible education. The idea is to ensure that persons with disabilities from very early childhood until they are adults can enjoy lifelong learning, and they have access to inclusive quality education throughout their lives, and that these inclusive settings are supported also with by different means, including European funds where possible. The area of access to healthcare is also addressed from this equality perspective, and in particular, this has been a challenging area in these times of COVID, where we have seen persons with disabilities disproportionately being hit by the sickness and the consequences of it. The idea here is that to establish and step up the dialogue with the Member States through the steering group on promotion and prevention for sharing and validated health-related good practices, and some punctual actions related to also cancer prevention. And in addition, an important element from a European perspective is the call to the Member States to develop and support strategies for patients with disabilities related to rare diseases, because in order to make use of the scarce resources that are in this area. Two additional areas, thematic areas from this equality perspective are access to culture, leisure, sport and tourism, where what we would like to see mainly is that persons with disabilities become actors, active members in creators of culture and sport, and that they can enjoy tourism on equal basis with others. We come now to the area of ensuring safety and protection, which probably is one of the areas that is most relevant is very relevant for the subject of today. And there, the issue of violence against persons with disabilities is also addressed, and measures are set forward for prevent and address the situation also of persons with disabilities in disasters. For example, in events such as floods, earthquakes, and disaster recovery, and where it is highlighted the importance of accessibility and disability inclusiveness that need to be included in emergency plans and in civil protection, assistance. In relation to that, the Commission refers in the strategy towards a common European standards on civil protection operations, and the Commission will include awareness raising to improve safety for vulnerable groups, and EU funding will be used to raise awareness on the need of persons with disabilities using civil protection meetings of the Civil Protection Forum and the Union Civil Protection Knowledge Network. The Commission will continue to finance the training programs for disaster situation, including preparedness, projects and exercises, taking into account the needs of persons with disabilities and strengthening dedicated monitoring in prevention actions. Let me continue by introducing the next chapter, which is is the area of promoting the rights of persons with disabilities globally. Here, it's a very comprehensive chapter that contains issues related to external action, to development cooperation, to humanitarian aid and enlargement. Maybe just to raise some highlights, the strategy refers to that persons with disabilities are among the most vulnerable in humanitarian crises, and in disasters their mortality is higher than in other situations, than by other groups. There will be many tools used to improve the situation: cooperation and humanitarian actions and dialogues with the International UNCRPD Committee also. The Commission will continue to deliver humanitarian aid and protection based on needs in accordance with humanitarian principles, and we'll aim to ensure that persons with disabilities are adequately addressed in EU-funded humanitarian aids through strengthening the involvement of persons with disabilities and cooperation with civil society, also to build also capacity, which is an important point, and to collect data to better understand the situation of persons with disabilities in these instances. Now, the last two chapters of the strategy are about relates to the efficiently delivering of the strategy, and there we deal with issues how to mainstream disability in EU policy making, how to step up the cooperation between the different European institutions, and how to work better with member states, regional and local authorities. We also highlight the importance of the use of EU funding to that effect, and in Chapter 8 we deal with how to implement the convention and how to improve the situation of persons with disabilities in the European institutions, both in terms of employment, but also in terms of accessibility of the buildings, but also the accessibility of information and communication technologies. Finally, we aim to accompany this strategy with awareness raising measures and to strengthening the visibility and the participation of the EU in international fora related to the UNCRPD. And this strategy itself, it proposes ways of better monitoring, continuous monitoring and reporting on its implementation, so that it can be followed up through indicators and some publications in a very transparent way. Well, this is what I wanted to tell you about the strategy. I hope you get a flavor of the richness, of the comprehensiveness of the strategy, and I hope you will be able to have a fruitful discussions on this subject today. Thank you very much for your attention.
Yes, so I think that was a very good introduction, showing the importance on the attention that is given to the subject of today from the EU to improve the situation with people with disability in all kind of activities. But now we will move to the core of our subject, and we will start with a presentation from Giampiero Grifo. He is a member of the European Disability Forum and chair of the Italian Network on Disability and Development. So Giampiero, the floor is yours.
Sì, good morning to ladies and gentlemen, and I'm very grateful for this opportunity to present the action that is possible to developing in the field of the humanitarian action, disaster risk reduction, and different action in the international cooperation. I represent an organization, a mondial organization.
Giampiero, sorry to interrupt you. Can you put it in full screen? Your PowerPoint,
Yes,
please?
yes.
Yeah. Thank you.
Yes. A moment. Okay. So I represent an international organization, Disabled People International, that are present in 142 national assembly. In the same time, I have in the board of the European Disability Forum, the main recognized representative organization of the 90 million of the European citizens with disability. And in the same time, the Italian Network on Disability and Development, they are a new form to organize activity in the development action that include 3 organizations that work on the field of the cooperation, international cooperation as NGO, and 2 organizations that represent persons with disability in Italy. The possibility to intervene in this action need to start from the high recognition of the right of persons with disability for the United Convention of the Right of Persons with Disability. They are international standard that are ratified for 94.6% of the member states of the United Nations, and they have a very impact on disability policy. Change the framework from the medical model to social model of disability, encourage participation and involvement of persons with disability in all issues, and indicate the mainstreaming and monitoring disability in all activity. The change from a medical individual model of disability to a social model of disability is possible understanding with the definition of disability into the convention. Is interaction from between person with impairment, attitudinal and environmental barrier that hinder this person to participate in equal basis with the other. This means in the field of the international cooperation, more in emergency, that is society that produce disability and create condition of exclusion of persons with disability. For that, the Article 4, Paragraph 3 of the Convention stress that persons with disability need to be included and involved in all action that are related to their rights. The Sustainable Development Goal, as you know, is based on the no one left behind and consider persons with disability in a field of the human rights. Specific reference are in the Goal 4, in the Goal 8, in the Goal 10, in the Goal 11, and in collection of the information and statistics. And other issue very important is the United Nations at the specific office under the General Secretary, Antonio Gutierrez, that are responsible to mainstreaming disability in all United Nations activity. This means that the United Nations include in all documents, in all activity, the population with disability. The Article 33 obliges the state party to organize a system of monitoring controlled by the United Nations. This means it's a new form. Now the policy related to persons with disability is an obligation of the state party that ratify the convention. In particular, the Article 11 related to the protection and safety of persons with disability in situation of risk, it's been armed conflict, humanitarian emergency, and occurrence of natural disaster is a very important issue that very change the approach on this kind of population. Because in the past, this kind of population are neglected. Frequently are not considered a population very important to protect. The change is from a humanitarian approach to human rights approach. An humanitarian approach are interested to produce immediately an action to protect person, basic protectness. It's a military culture, limitation of the losses, charitable vision, beneficiaries are not able to participate, and there are two-time approach, the first aid, food, health, and housing. The second action for other needs, for persons with disability, this may not have a situation in different areas like the accessible toilet or other attention, and frequently the rescue not respect human rights. During the last pandemic, we understand that there are a very important experience to show us very little attention in emergency intervention was developed. The lack of supply of tools for protection, lack of accessible information and the public communication, medical triage, stress from some organization or professional that in absence of the enough resource of human and hospitalization resource, the person with disability need to be excluded for the attention on the care and the activity. In many countries, you are in the US state, in Quebec, in Catalonia, in other countries, this means that person are not protected enough. We don't have information. That is another important issue because this is a very important issue. Human rights approach is a very changing because all persons enjoy about the same action in activity. The emergency system must include in all clusters the person with disability, specific training of person with disability need to meet in place, and in the instrument of provide appropriate rescue, accessible camp, and so on need to be developed. It's evident that this new approach have an important exigence to have an appropriate training of the staff at different level. The United Nations are approved in series of the document like Sendai Framework for Disaster Risk Reduction, Charter of Istanbul for Inclusion, the Guideline for Inclusion of Persons with Disability in humanitarian area activity, and this is a very important even for the refugee. The Global Compact Refugee intervene exactly on this issue. The element common in the United Nations document is respect human rights and prevent discrimination, encourage the participation of disabled people organization, offer appropriate, accessible, and inclusive recovery involve civil society organization to contribute for the need of assessment and community empowerment, promote inclusive sport, cultural activity, and so on. This is very important that the change of cultural approach are now are now obligation of the state. It's evident that these are a very difference about the international debate and national action to improve this kind of activity. In European Parliament, they are the first document of the natural disaster on the resolution of European consensus on humanitarian aids. It's evident that in this kind of the context, there are the Council conclusion on disability inclusive disaster management, the ECO operational guidance that are developed from the DG ECO, and in the same time, the same Council of Europe are different documents in this field. The second point is the Article 32 that obliges the international cooperation to include persons with disability, to involve organization of persons with disability. Even in that, the European Parliament resolution, the European consensus are very important. And in the same time, the strategy that are developed by the organization, by the European Union Commission that are explained by Immacolata Plasencia before. Italy have a very important role. The first document on the fields to rescue persons with disability are developed in Verona Charter in the 2007. In this action, the Italian Agency on Development are very active to produce 3 guidelines on development of persons with disability, an action plan based on the convention, a vademecum on humanitarian aids and disability, 2 mapping, the project financed by IHS are developing very important. In the same time, there are other issues related to accessibility at all levels. There are 2 action plans. The action plan of the International Cooperation Agency is an important issue based on the convention. They are including the biennial action program of Italian. They are introduce this agency disability marker. This disability marker show us the engagement of Italian cooperation is the 3.68% of the budget, the total budget of international cooperation. Evident, there are the guidelines specific on the mainstreaming disability and social inclusion in AIDS project. Even the Italian Network on Disability Development are develop a different manual, action, activity, and in particular, the activity are related to emancipatory disability research. The person with disability become a person researcher that study direct their condition with the support of the university competence. In the same time, we are developing the peer council of the emergency that in emergency situation help person with disability to impact with the new condition, because frequently during the war there are different persons that became disabled. In Palestine, we training different person as a peer counselor, and after 4 years of work, they are building up the independent living center developed by the same organization. The stress that I put in your attention that persons with disability are the subject of the change, not only the action, the person that they are touched by the intervention of others. It's evident that DPO are the real sustainability of the CRPD application. For that, we empower with training this organization. And at the same time, the competent participation of persons with disability in the decision related with their rights produce innovation. For that, the nothing about us without us is not only a slogan, it's not only a methodology, but it's a right that even in emergency need to be developed at all levels. Thank you.
Thank you, Gian Piero. I don't know if there are questions now, but I have one for you about international standard on inclusion of persons with disability in emergency and humanitarian action is really changing. So you mentioned all the evolutions and all the new activity. But how is it at national level? Do you see this new cultural and technical paradigm applied and enforced? Is it really relay at national level?
The problem is exactly that. During the discussion at the international level is very important, and the development of the awareness about the human rights and the different tools to put in action need to be a very important changement and new approach. Really, at the national level, they have the problem to transpose this approach in the field of the national action in emergency international cooperation. One of the issues is the role of the organization of persons with disability. Actually, are not so much knowledge about the organization of persons with disability on the field of the emergency, for example, of the international cooperation. Even the experts on the field of disability are not yet so developed, and this is one of issue that in next future is important to improve, because this contribution are very important to permit to understanding the human right of persons with disability, and at the same time to offer the new vision, new capacity to emphasize in the international cooperation and in the emergency activity, as the contribution of this knowledge and competence can permit to have a better action in the field. So this is a new challenge for the organization of persons with disability, a new opportunity for include better the need and the right of persons with disability in this field.
Yeah, thank you, Gian Piero. I think in your presentation you make the point also between object and subject. So it's important that people and organizations dealing with disability are really also subject of the change on the implementation, even though there are some challenges. So thank you. We can move now to the next speaker. It's Stefano Zanut, senior officer at the Italian Ministry of Interior, working at the National Fire and Rescue Service. He will present emergency preparedness and response to people with disabilities, the Italian experience. So Stefano, the floor is yours.
Okay. You see my presentation, my slides?
No, you have to share. You have the presentation bowl, so now you can share the content.
Okay.
Like,
Okay. Okay.
And to put it in full screen also.
Okay.
Yeah, perfect, Stefano. Thanks.
Thank you. Good morning, and thank you for the invitation. I apologize my English, but slides are better. I want to talk about our experience on the field of safety and rescue for people with disability. I am Stefano Zanut, a fireman, senior officer of the National Fire and Rescue Service, and member of the Observatory on Safety and Rescue for People with Special Needs. Since 2001, I've been working in these topics in a specific working group, then evolved in 2015 into the Observatory, a national organism that aims to coordinate activity on inclusive safety and rescue. All these ventures has been conducted with the involvement of people with disability through their organization and experts on this field. When we talk about emergency and rescue management, we refer to an environmental condition compromised by specific event, for example, earthquake, flood, or fire, which people must face adopting mode that can protect them. It is in that context that the rescuer operates. They have to simultaneously relate both to the effect environment situation and to the people they must help or rescue, taking into account their specific needs. This video, for example, shows one of the several situations where Firefighter operate. In this case, a flood in province in 2014 has involved many isolated houses with people who are unable to live safely. The intervention has helped an elderly person with walking difficulties in wheelchair, and the rescuer have to resort an ingenious artifice to bring elderly in the amphibian. Next slide, this slide shows the intervention carried out in Italy in 2016, involving person we are talking about. Data are significant. 23,625 interventions, corresponding to an average of 65 per day, number that represent this reality as a condition that not all remote and therefore to be considered in rescue planning. The experience acquired in the rescue and shared with the stakeholder in a framework of a common path has led to a possible scenario like the one illustrated in this slide. On one side, the rescuer, on the other, the people among whom he must to be able to identify those with special need. However, to be able to do it, he must obviously have gained some skills. First, how to recognize the special need and these people and the way to meet them during the rescue. How to relate to the person to be helped, also through the people close to them, for example, caregivers or others. How to manage the scenario, also through the available resources, for example, area of refuge or devices such as the evacuation chair. Further factors can make rescue activity more challenging, for example, the personal protection equipment of the rescuer, mask, helmet, gloves, which can compromise the communication. In this period, for example, the COVID-19 emergency required the adoption of devices and measures, face masks, gloves, social distancing, to reduce the risk of transmission. This aspect too can affect the general management of the intervention, increasing the difficulties and the communication. Problems, however, should be overcome together, inclusively, involving people so as to make them feel like the heroes of their own safety. In fact, we cannot forget that rescuers always arrive after the event. And in the meantime, people must be able to manage the situation alone and with the available resources, not least with the contribution of the family member or other. Furthermore, it is important that persons make their needs clearly understood by the rescuer, and also for this reason, they must get prepared to do so. With this regard, a tool that can be useful in the rescue card, which will be illustrated later by Elisabetta Schiavone. Substantially, this person should manage the scenario while waiting the arrival of the rescuers. Acts to help, obviously having suitable tools available for this purpose. A deaf person, for example, should be able to dial 112 to ask for help, interact with the rescuer to communicate their specific need, and how to meet them. Here, the rescue card is certainly useful. I wanted to highlight this aspect before going to talk about our experiences because, I repeat, rescue is often performed together, the rescuer and the person to be rescued. And its difference may also depend on our ability to build this synergy along a cultural pathway that must accompany us in the daily life. This is the direction taken by the National Fire and Rescue Service on the matter of the inclusive rescue activities, and they want to talk about two experiences concerning two different types of disability. The project I Help You to Rescue Me on the theme of autism, and the exercise performed in summer 2020 involving people with multiple sclerosis in domestic environment. The experimental lab on the rescue of autistic people was born in Pordenone with Children and Autism Foundation. The central issue is the connection between two or more persons in the rescue scenario and the relative communication aspects. I Help You to Rescue Me seems to be a challenging title, but it actually opens up a new perspective on this front, whose focal point is the proactive involvement of the person and the selection of most proper way to communicate with them, also in emergency situations. With the contribution of experts, we have developed a publication titled People with Autism Spectrum Disorder during an emergency, vademecum for rescuer, organized starting from the action performed during an emergency situation. In several occasions, the Children and Autism Foundation has invited the Firefighter to participate in training seminar with involving people with autism. In this way, information on autism, together with concrete experiences, made possible to transform the vademecum into operational guidelines for rescue. Moreover, fire vehicles have also been equipped with a carabiner with images to communicate to development of the situation, an aspect which has been focused in the training courses. The second experience was an exercise performed last summer and involving people with multiple sclerosis, a neurodegenerative disease that covers various aspects ranging from disability to communication. This initiative has been carried out together with the Italian Multiple Sclerosis Association. The exercise was conducted simulating scenario in which the rescuers operate in various situations of daily life and in different type of building, with apartment at the ground floor or in tall building in which the damage of stairs and elevators was also hypothesized, thus requiring the use of more complex technical procedures. This experience were conducted in Ascoli Piceno, Pordenone, and Genova at different levels in each of these cities. Also using the new ladder truck generation with devices that can really help in rescue scenario of this kind. Familiar was being always involved, and the use of the rescue card has been important, because it enables them to inform the rescuers about their needs, also asking them to participate in more general management of the situation. For example, evacuating the person with their medicine, a recurring aspect in emergency situation. The various situations pose a different level of complexity, and one in particular, the firefighter had to face with a very critical issue. A family consisting of an elderly woman with multiple sclerosis, he was in wheelchair, an elderly man, and their son, an autistic adult man. 3 specific needs requiring 3 models of operation. This means considering a real scenario. A particular synergy emerged also from this experience between rescuers and people with special needs, who in addition had the opportunity to get to know each other. I would like to conclude my presentation introducing the 2 projects we are working in this period, the guideline for inclusive rescue and the app called Help for All. These guidelines are rescue management tools which take into account the special needs of persons and are being developed considering the intervention starting from the emergency call. At present, the guidelines available are those for intervention involving people with visual and hearing impairment and people with autism. Shortly, guidelines for motor disabilities, Down syndrome, and dementia Alzheimer will also be completed. Help for All is an app at the moment available only for Android phones, which provide user with a modes of operation to adopt in case of people with motor disabilities at various levels in multi-story building and with different type of wheelchair, sensory, visual, and hearing impairment, and cognitive disabilities, autism, and Down syndrome. In addition, short explanatory video are included. This is the pathway of the National Fire and Rescue Service, along which people with special needs have been involved in building an inclusive culture of safety and rescue. There is still much to do. We start from this experience and make them available for everyone. But finally, I want to give you a provocation. There is no inclusive rescue, but only rescue. We have to rescue better everybody. Thank you.
Thank you, Stefano, for this provocation. I think it's more than a provocation. It's a real declaration about equal rights for all. I have one question about your operational difficulties. You mentioned that. From your experience, what worked best to conduct effectively search and rescue operation for people with disability? Could you give us some more illustration on that?
I start from my experience. I have 3 points to develop. The first is a good management of rescue call. All citizens should know how to represent their specific needs. Surely, this allows rescuers to work better. Second, the knowledge of the environment strategies that the user have to know, as I said, while pending the arrival of the rescuer. Third, rescuer need training on scenario very similar to reality. Knowing how to ask for help, know the environment safeguard and their use, and know how to help, this is the recipe. Operational difficulties. Every day in my work we have operational difficulties, different one each one. But we cannot arrive to the scenario without operative instrument. We have to build them before. So we have three instruments: training, planning, and technology. We need so to deal with difficulties.
Yeah, thank you, Stefano. We might come back later on about the tools that you were mentioning about the app that you have in developing Help for All. So, but later on, after all the presentation, I will come back to that about the technology as well. So thank you, Stefano. Now we can move to the next speaker. It's Elisabetta Schiavone. She will present safety and rescue for people with special needs. She is a member of the Observatory on Safety and Rescue of People with Special Needs. And I think that you have worked already with Stefano on some common projects. So the floor is yours.
Yes, good morning, and thank you for inviting me to this conference full of sharing and experience. My name is Elisabetta, and I'm an architect, technical director of Soluzioni Emergenti Startup, and I'm in the board of the Observatory on Safety and Rescue of People with Special Needs of the Italian National Fire and Emergency Service, same as Stefano Zanut. I apologize for my English, and that is the reason why I prefer to record my speech, preventing to compromise the message I prepared for you all. Good vision.
Dear all, welcome in Italy. I am pleased to share with you some of the experiences gained over these years about emergency and fragility, which a year ago gave birth to Emergency in Solution, the startup that through a network of multidisciplinary expertise makes available to public administrations and private entities specific skills in the area of inclusive safety, inclusive rescue, emergency planning and management, considering the special needs of everyone. Please don't be offended if I let you in through the emergency exit instead of the main entrance. This is the assumption with which we started Emergency and Fragility, dedicating an important reflection on urban planning, the project and redevelopment of buildings, starting from the emergency and considering the special needs of people with disabilities, elderly people, children, and anyone who also following the consequences of emergency itself is in a condition of fragility. The goal is bring into daily practice, in the workplaces, in the home environment and everywhere, what we've started to share and tried out with rescuers, designers, experts in disaster medicine, and organizations representing people with disabilities. The participation of different fields representatives allows us to look at the emergency from different perspectives. If we want to build a well-working hospital, we need to talk with doctors. If we want a well-working school, we need to talk to teachers, but first of all, to the students. If we want to build resilient communities, the emergency must be a topic discussed with people, including those with disabilities in the decision-making processes to define tools. This is the approach that has characterized our path. Safety and emergency cannot be topics of the insiders. The emergency is not an exclusive area of rescue and planners, but considers as fundamental the contribution of the project, especially inclusive design and inclusive safety, to ensure the possible autonomy of the most fragile people, even during the emergency. I've been dealing with inclusive design for 20 years now, and with inclusive safety for about 10. A natural consequence of a path that always considers people the center of the project and the center of every question raised by the design process. The project of the environment must consider the activities and functionality of people from ordinary to emergency, guaranteeing autonomy in the response to this last one. When we think of how to improve the performance in rescue operations and how to increase the resilience levels of the population, we must imagine that every action, every activity does not take place in an abstract bubble, but in the built environment. The environment which, according to the ICF, helps to determine the condition of disability of each, and in case of emergency could lose its facilitator characteristics and acting as a barrier to the people. Now I'm coming to Disability and Emergency Project. This project began in 2014 in Ascoli Piceno, one of the main cities of the Marche, an Italian region that suffered the consequences of the earthquake that hit central Italy in 2016. The continuous shakes literally exasperated people living in that area, and for a very long time, many of those people slept in their car, afraid to be surprised by the earthquake during the night. For people with disabilities, however, this solution was unthinkable. In this context was born Disability in Emergency, in order to respond to people fragile and exhausted by fear, and by the awareness that evacuation for many people with disabilities would have been more difficult than others and impossible for somebody else. Disability in Emergency was born as part of the Emergency and Fragility Project from the cooperation between the municipality of Ascoli Piceno, the Chamber of Architects, and association representing people with disabilities. The goal was to map fragilities and, at the same time, to give information to people with disabilities and their families about safety and about how to behave in the event of other shakes. In summary, the project included the following actions: get information on specific needs and location of citizens with disabilities and frail elderly people, useful to ensure adequate intervention to these needs in case of necessity, to check the accessibility conditions of accommodations in relation to rescue or evacuation purposes, and give indications on the behavior to keep during emergencies. Support the preparation of inclusive family emergency plans and information on the civil protection plan on the other city. For this purpose, special checklists have been created for the survey of specific needs, designed in collaboration with people with disabilities, and other checklists for the survey of any environmental problems that could create evacuation or rescue difficulties. Information on the critical issues related to the accessibility of housing by emergency vehicles during the rescue and evacuation operations may prove to be particularly useful in relation to the urban layout that distinguishes the historical context of our country, characterized by ancient narrow streets and pavements that are not always accessible with wheelchairs and stretchers. The analysis was also an opportunity to better understand what contribution the design of building can guarantee to reduce the impact of an event on people and their response to the emergency and rescue operations. Disability in Emergency was the first experiment of a structured mapping system based on self-assessment of the population, which we plan to develop shortly. Now let me go through the Inclusive Rescue Project and to get you with some information about that project. The checklists of the specific needs elaborated into the Emergency and Fragility section were actually the starting point for the creation of the information sheet for rescue as a part of the Inclusive Rescue Project created by the Italian Fire Emergency Services in collaboration with the Italian Multiple Sclerosis Association, which I represent. Stefano Zanot, in his speech, illustrated operational procedures and rescue methods, while I will focus on the card and on the contribution that this tool can provide in order to optimize the rescue response and help to promote the safety and prevention culture in the population. The rescue information sheet for the rescue is a summary document that provides immediate information on what to do and not to do when the rescuer gets in contact with the person with special needs and it's necessary imagine some particularly rescue aspects. In this slide, for example, you can see Eleonora, my sister. The first part contains the personal details, contact information of family members, doctors, and other persons useful for managing the health and autonomy of the owner. The second part contains information on specific needs in relation to the different functional areas, pathologies, allergies, drugs, or any therapeutic plan. Needs related to mobility, sight, hearing, cognitive, behavioral aspects, modes of communication, needs related to nutrition, aids, and more, such as the specific modes of transport that you also saw in the previous intervention. The form is filled in directly by the person with disabilities, or if that person is not able to do that, by the caregiver, and can also be useful in the event that the person with disabilities or the caregiver in an emergency does not have the possibility to communicate with the rescuer. For example, the loss of consciousness or the failure of devices used to communicate, for example, an eye pointer or any other device. The contribution of the rescue information sheet in emergency preparation in the management of the individual response and intervention by the rescuers is structured as follows. The person with disability becomes aware of their priority needs in an emergency and will be able to build their own response strategy. The rescuer receives in advance the information necessary to manage the response, starting from emergency call, the operator, following the checklist, and interviewing the caller, so he or she will be able to understand which rescue mode he or she will have to adopt and how to approach and rescue the victim. During the SARS-CoV-2 pandemic, we also found the usefulness of this tool for frail patients hospitalized without the possibility of being assisted by a caregiver. The management of complex patients by healthcare personnel without any specific information can really compromise health and lead to a traumatic experience for the person removed from family members. Now I briefly get to the conclusion. The tools shown belong to experiments conducted following events that have had a great impact on people with disabilities. The earthquake in central Italy and the SARS-CoV-2 pandemic. Currently, both the fragility mapping cards and the rescue card are being implemented. In both cases, the main objective was to guarantee people with disabilities an adequate response to their specific needs in the event of an emergency and in all of the rescue phases. In addition to being a technical component of the Observatory, as a caregiver, I firmly believe that another important goal achieved is the emergency preparation of citizens with specific needs, as they are used by people with disabilities and caregivers, and their participation to the implementation of the procedure really increases awareness of their condition during any emergency. This is the real basis for creating resilient communities. Furthermore, from my perspective as an architect, practices in these areas gives me the opportunity to look at what has been done by observing the interaction between people, rescuers, buildings, and infrastructures in the emergency phases to come to a better understanding of which functional and constructive characteristics can improve Also in terms to the type of assistance provided and above all guaranteeing autonomy of survival in the emergency. Now time has come for me to thank you all for your attention, and I wish you everyone good job and fruitful proceedings. Thank you.
Thank you, Elisabetta and Stefano. Personally, I think that your English is very good, so you should not be too shy for speaking with us. For Elisabetta, I've got a small question, because you mentioned the rescuer card as a very good solution to improve the handling of victims with disability. I have one question about this rescuer card. Is it a local initiative or a regional initiative, or is it a national initiative?
Is the national initiative, is an initiative of Observatory of Italian National Fire Safety Rescue of People with Special Needs and Multiple Sclerosis Association.
Okay, thank you. Because it's also for Stefano. Do you think that you get all the information that you need from the rescuer card? What is your view on the usefulness of this? Does it help you to solve some of your questions when you are rescuing people with special needs?
Sorry, I don't understand.
It was also a question to Stefano to see what are the benefits of the rescuer card for the rescuer. So when you are going to rescue people, when you have all the information, does it save you a lot of time? Does it help you to adapt your procedures?
Yes, I will talk about the rescue card. We experimented the rescue card in the scenario of with the last summer. I have talked about we use in Ascoli Piceno, in Pordenone, in Genova. In all the scenarios, we use that card, and so now we have a new edition that we would like to propose in the next month. It's important because the rescuer, when arrive, don't know who is the person who is in front. Okay, if the person of the familiar know how to communicate his or her special need, for rescuer is better because don't because have more information.
Okay, thank you very much. I think there are some other questions, so please check in the chat because we're going to address them during the Q&A time after all presentation. Now we move to the next presentation. It will be Kagla Akungor, who is a project manager and who is working for Acute, which is a search and rescue association in Turkey, and he will present some results of the projects they have been conducting to assist people with disability. So Kagla, the floor is yours.
Thank you very much. I'm saluting all my fellow speakers and all the participants. Thanks for being here, and thank you for inviting me. So I'll try first to share my screen. Here we go, I guess. Okay. Can you see it? Okay.
Yes, if you can put it in full screen, Kagla, please.
Okay, good. Give me a second. Should be okay.
Perfect, thank you. Yeah.
You're welcome. So my name is Çağlar Akungor. I'm a doctor in political science and specialize in disaster resilience. I'm also a member of Turkish Search and Rescue Association, AKUT, which is an INSARAG certified rescue team, and also one of the oldest and largest volunteer rescue organizations in the world. I'll talk to you about the lessons we have learned while leading the development of Turkey's first disability inclusive disaster preparedness training program. I believe these lessons are relevant to any similar situation where you might want to design a specific solution with respect to disaster and disability, such as in the case of, for example, search and rescue protocols, specific techniques, tactics, or maybe technologies. From 2015 to 2017, I worked as a project manager for this organization, and I led AKUT's participation in a Horizon 2020 project, which was the EduSen project. EduSen was aiming to demonstrate the need to take the culture as a relevant asset for building resilience, and it gave us a formidable opportunity to tackle an issue that AKUT had long been facing, which was the inaccessibility of its community disaster training to people with disabilities. One thing to know here is that AKUT is indeed a response organization, but its secondary mission is to educate the general public about disasters and disaster preparedness. The association operates a training program that reaches a significant number of people every year on a national basis. And the problem was that this program had nothing relevant to disability, neither in its content nor in the form of the training sessions. The program was inaccessible, especially for people with hearing or sight difficulties. Therefore, our expectation in the project was to come together with disability organizations and to develop a solution that would allow us to reach these groups, which were estimated to be around 2% to 3% of the general population in Turkey, which is quite large. When we first started, I think we were naive in the sense that we thought we would be dealing mainly with technical adaptation. For example, by producing text-based material for the deaf, or printing in Braille for the blind people. Yet, once we started to work together with disability organizations, we understood that the task required much more than collecting end-user feedback and adapting an existing material. Very early, thanks to the encounter with people with disabilities, we recognized two things. The first one is disability was not a medical condition, but it was a human condition that arises when a person's impairments meet an unfavorable social and physical environment that prevents this person to use his or her own full potential in life. The second thing we came to recognize is that we saw that the people with disabilities had already the keys to the solutions we were looking for. So we didn't have to reinvent the wheel. We just needed to remove as much barriers as possible so our collaborators with disabilities could participate in the action in the project as equal partners and share their knowledge with us. Consequently, we renounced most of our initial ideas thanks to what our partners with disabilities taught us. We understood, for example, that most people with hearing or sight difficulties were excellent technology users, and they relied on tools such as text-to-speech applications, audiobooks, video books, sign language videos for diffusing the information. Therefore, it would be completely unpractical, not to say useless, to come up with printing documents for the deaf or to produce Braille prints for the blind while we have all those technology solutions in place. Another example I can give is that, for example, we abandoned the idea to organize separate training sessions for people with disabilities. We understood that such an approach would bring nothing but further isolation and even stigmatization for them. And an inclusive training where people with disabilities and without disabilities are trained together is much more efficient. in the sense that the non-disabled population learns about the needs, but also the capabilities of the participant with disabilities. Therefore, we ended up by producing a single core training material, which is a PowerPoint slideshow that could be used for a mixed audience. So we created a training material that would allow people with hearing and sight disabilities to receive the training together with the rest of the population, and most of the time without having the need to have a sign language translator in the room. And also the content was updated to include specific tips addressing some disability issues. To illustrate what we have done a bit, I'll present some slides as an example. So for example, this is in Turkish. This is the one of the earthquake from one earthquake section of the training. It says drop, hold, and cover, the international slogan for what to do during an earthquake. As you see, what we tried to do was to create slides with one simple picture and one slogan, so that can be easily understood and can be remembered. And for each slide, we added the sign language translation video on the right side corner. The other thing was the simplification of all slides. So as you see, there's a very little writing in each slide. There are no texts, nothing, just one picture, and it's very clear. It tells you what to do. You don't take elevators during an earthquake, fire, etc. Also, the next one for videos. All the slides with videos were added, and audio description, so a narrative which is telling what's happening in the video for people who are blind, but also we added subtitles for people with cochlear implants, because although they can hear quite well with the implants, they can't hear some frequencies, and they were all complaining about the difficulty of understanding the sounds, the background narration in videos. So together with the sign language translation, we added the subtitles and audio description for slides of videos. And lastly, we also added some specific slides. It should be 3 or 4 more that were relevant to the needs of people with disabilities in case of a disaster. So this is a very short video. Please pay attention. You will see that the trainer, if the trainer respects the timeline, his narrative is synchronized with the slide. Therefore, we can do most of the trainings without having a sign language translator in the room. This is, by the way, a mixed training. These are groups of deaf people with their families who are getting this kind of training for the first time in their lives together. Our time is a bit limited, so I'll try to go to, that's one thing. And to support the core material, we also provided downloadable, online available versions of the sign language videos, and as an audiobook available on Akut's YouTube channel, where people with sight or hearing disabilities could download, use, and diffuse as much as they want. So now to come to some lessons we have learned during this field action. The first one will be how to frame the issue, this disaster and disability. So whatever solution you develop with regard to disaster and disability, the first thing we understood is that addressing the needs of people with disabilities is not a question of empathy. It's simply a question of human rights. No one needs our empathy. We just need to recognize everybody's rights and treat them as equally. So When it comes to disasters, that means that people with disabilities have the right to receive the same level of protection as is given to the rest of the society. And it's part of our duty to provide that equal service. It's that simple. But unfortunately, in many examples, we see that people with disabilities can even be denied from disaster-related services because they constitute a minority, and it will take too much effort to develop special solutions for them, etc. That argument is totally against the human rights. The second thing we learned is nothing for them without them. We understood that the only efficient way of working on disability is to work with the people with disabilities, because they are the best guides who can help you find your way in assisting them. And it's crucial to ask for their help and for opinion all the time. As for the disasters, it's best to ask people with disabilities themselves what they endure and what kind of problems they may be subjected to in emergencies and disasters. And also, it's vital to include people with disabilities in every step of the action you are taking, from the design stage to the implementation stage. Whatever you work on, that could be development of a specific search and rescue protocol, or technology, or anything else, but they have to be part of the action as equal partners. One thing is about raising awareness. People with disabilities are not more or less interested in disasters or emergencies than the rest of the population. Disaster preparedness or search and rescue may simply not be a part of their agenda. So there is need to reach out and raise awareness about what we do to find partners with disabilities. One very important element is to remove the barriers. So that requires first to transform his own perspective on disability, to consider disability as part of human diversity, and ask which barriers we can remove in order to include people with disabilities in what we do. And these barriers, I would like to emphasize, are not always physical. The mental barriers are sometimes much more stronger than the physical or material barriers they face. The prejudices or the preconceived ideas we have are in our minds. That therefore, usually removing those barriers requires more will than material resources in many cases. Ensuring the necessary adjustments in the physical environment and, if necessary, the social arrangements in order to make your action accessible to them is a prerequisite for inclusion. And one thing, 100% accessibility is rarely possible, but people with disabilities themselves, they are aware of that fact, and they are ready to compromise if they see that you do the effort. Another thing we have learned is that not every person with a disability will need assistance during or after a disaster or emergency. Depending on the disability type, they can preserve their autonomy just like the rest of the population, provided that they benefit from the same level of information, material support, assistance, and service with the others. And regarding disaster preparedness, it's vital to recognize the potential of the disabled people and not to deny them any information given to the rest of the population. One important finding we observed is that there are different disability cultures, and these can enhance the efficiency of disaster preparedness, such as, for example, we saw that especially deaf people in Turkey had very, very powerful and large networks. And lastly, one thing, we understood at the end of our project that all the efforts you do in order to address the disability issue, including disaster, is always useful and beneficial for the rest of the population, for the general population as well. In this example, for example, when we simplified our training, we also made it more accessible for people with low literacy or for kids. So to finish, I'll just mention here that I prepared an extra slide with resources. You can go and check what had been done by Akut during the project and get some information about EduSen. And I'd like to put here at the first place one resource we benefited a lot in the beginning, a little booklet by David Alexander. That's very useful. And lastly, if you'd like to contact me, you can send me an email or add me to your professional network. Thank you very much for listening.
Thank you, Kegler. I mean, again, I think that's a common feature from many about the human dimension and the cultural dimension. You mentioned that it's not only tools, but this aspect have to be taken into account. So, giving your experience, what could be the key things in people with disability?
Could you elaborate your question a bit? Like when you say your key things?
Yeah, so it was when you are mentioning the human aspect, you mentioned also the different culture, disability cultures, how you approach the different cultural aspect within the, because we are speaking about disabled people, but we see that there are variety of disability, a variety of issue. So how can you cover these different disability cultures?
That's a very good question. Thank you very much. Well, our friends here who are with us and who have disabilities, they probably will know it much better than I do. But what we have observed is that every disability community has its own culture. That is true, and there are cultural differences to be taken into account. I just mentioned, for example, how powerful networks were with the deaf community, and one interesting thing, those networks those days were extremely fast through the technological tools. They all use sign language, video communication for keeping those networks alive. One observation I did in Turkish context is, for example, people with sight disabilities were also very militant in the sense of advocacy for disability rights. They were much more sensitive, while, for example, deaf more or less accepted the problems we had on that plan. So I believe it's a different approach should be developed while working with different disability types. But the essential thing is to build a relationship of trust, because they encounter a lot of organizations, a lot of projects coming and going, that starts and once achieved, they are never called again, never contacted again. And they see a lot of those cases. So every new initiative for them is something they should invest in, and they want to see the continuation of what they do, and they want to be implicated in it. They want to be part of what they do.
Okay, thank you. Thanks a lot, Kegler.
Welcome.
Then we can move to our last but not least presenter. It will be Laila Craig, who will mention and present to you how to empower deaf, hard of hearing and deaf blind people to advocate for better access to emergency. And she will share with us her experience both in humanitarian action and also the work now she's doing in Australia with the firefighters. So Anthony, if you can
You want me to show the video, or maybe Rebecca, you want? I will unmute you. Rebecca, yeah. Rebecca, did you receive the unmute request, or is it Kylie? Maybe I will. The request is sent.
All right, apologies. All right. Okay, I should start again. Hello, my name is Layla Craig.
And I want just
and
to
thank you so much for. Yes, Anthony?
No, I would like. Oh yeah, I was looking for Layla to move her to the stage. Yeah, you see Layla now.
Okay, I have a video on right now.
So to all of you, all the participants, if you choose the layout stack, you should be able to see the same thing I see, which is Rebecca and Layla on screen. You can go ahead, Layla and Rebecca, because I'm speaking, so you all see my logo on screen, but once you start speaking, we will see you on stage.
All right, terrific, for sure, no problem at all. All right, so to introduce myself, my name is Layla Craig. Thank you so much for inviting me here. It's really lovely to see all the presentations today. I've actually made a pre-recording of my presentation, which I will share with you soon, and I hope that that will be uploaded very soon. In fact, I've actually changed the title of my presentation slightly, so it's all to do with disability inclusion and what people with disabilities need in emergency situations. Afterwards, I'm happy to answer any questions or respond to comments afterwards. Thank you so much.
Hi, my name is Layla Craig, and I want to thank Public Safety Communication Europe, its planning committee, and the presenters here for letting me join this presentation today. I'll be presenting about disability inclusion, why this is needed in emergency planning. However, before I present, I just wanted to let you know that as a deaf person, I have an Australian Sign Language interpreter with me who will be interpreting into spoken English, just in case some of you are wondering where the speech is coming from. I'd like to give you a brief background of my career and experiences in the disability inclusive disaster risk reduction, commonly known as DIDRR field for short, or DRR for disaster risk reduction. Having been involved in local and international research projects focusing on people with disabilities in disaster risk reduction in Australia and Southeast Asia, what impacted on me from those experiences was the fact that whilst I was aware of the barriers in accessing emergency information, it was through conversations with people with disabilities and the deaf community members that made me realise the disconnects between people with disabilities and emergency services. The stories of their lived experiences have demonstrated clear gaps on two things. Number one was that there wasn't enough knowledge and skills on emergency preparedness. And number two was prior very poor education and communication barriers to accessing emergency information and services. After one of the local projects I worked on, focused on the deaf community in New South Wales, Australia, and their resilience to hazards, which I will be covering later on in the presentation. But that made me realise what deaf people were facing in Australia was not an isolated problem. And at the same time, there was very limited research on people with disabilities and disasters. My theory was confirmed when I accepted a volunteer opportunity to work in the Philippines under the Australian Red Cross for 1 year, working with deaf communities in DRR, where the challenges were much greater with limited resources and capacities. And they were not the only one. Worldwide, this is a common problem. One thing I learned from working on projects in different countries was that people with disabilities were sometimes perceived as one homogenous group. While there is research that focuses on different disability groups and their experiences being affected by disasters, there is not enough that addresses specific disability groups and their needs in the DRR space. As the general research on people with disabilities in this area is growing, very little has been covered on deaf communities' needs in this field, which is one of the reasons that I decided to study a PhD, focusing on deaf communities and organisations' capacities in responding to and supporting those affected by disasters. Lastly, I'm also thrilled to be working in disability inclusion with Fire and Rescue New South Wales, who are focused on strengthening their community engagement with different disability groups. And again, I'll be presenting more about that later on. Background. UNESCAP 2017 stated that between people with disabilities relative to those without disabilities, 4 people with disabilities are likely to die compared to only 1 without disabilities in emergency and disaster situations. And why does that occur? There are actually many reasons. Some disaster management practices are largely top-down and exclusionary, which means that emergency management think that they know best what is best for people with disabilities without consulting with them on their needs. And this means that people with disabilities are excluded from any emergency planning processes. There are also disconnects between disability groups and emergency management. Some emergency services acknowledge people with disabilities, but the problem is that they don't know how to approach people with disabilities, which means that people with disabilities tend to feel neglected. It's the same experience of people with disabilities. Their lived experiences means that they know what kind of help they would like to get during emergencies, but they don't have the confidence to approach emergency services, which leads emergency services to think that they are okay. So this really shows a need for both groups to work together, to share and exchange knowledge and skills. We also need to change the charity medical model mentality to one of social or human rights. This is where some people view people with disabilities as those that need to be fixed or helped, but really people with disabilities do not need to be fixed. They would rather focus on how to break down the barriers for them so that they can participate in all DRR training, events and planning so that they can become more aware and prepared, just like those without disabilities. Lastly, the UNDRR SnR Framework 2015 to 2030 mandates stronger inclusion of people with disabilities in all DRR planning. The results of past disasters have shown again and again that a high number of people with disabilities have died, have been injured, or are unprepared relative to those without disabilities. So this recommendation of having people with disabilities in emergency planning will help increase their knowledge and understanding on DRR and reduce their risk to disasters. In the past, I've worked on 2 research projects that eventually led to practices in including people with disabilities in DRR. The first research was done in 2011 to 2013 on deaf communities in New South Wales, Australia. And that led to practice-based Get Ready project from 2014 to 2016. The second research was in 2016 to 2017 in Southeast Asia. And that led to several practice-based projects between disability groups and emergency services. I've chosen one of them, which was done in 2017, and I will explain a little bit more about these projects next. The project Disabilities and Disasters, Empowering People and Building Resilience to Risk, focused on different disability groups in 3 Southeast Asian countries, namely Thailand, Cambodia, and the Philippines. This was funded by the Global Resilience Partnership and led by the University of Sydney. The project's aims were to provide people with disabilities the foundations and support needed to respond to hazards and disasters, as well as have them become their own advocates within their communities. The research to practice has bridged disability organisations and emergency services together successfully. One of the pilots that led research to practice, in which I was involved, was the first regional Red Cross training for deaf community leaders, sign language interpreters, teachers of the deaf, and Red Cross staff. The research that we collected showed a massive gap in deaf people's awareness on DRR, with many of them mentioning that they would like to join training but had no access to sign language interpreters on the islands on which they live. Deaf Disaster Assistance Team, DRR, is a local deaf NGO and one of the project's partners. They decided to set up a regional training for Red Cross in Cebu, the chapter on first aid and DRR, for sign language interpreters. This allowed local deaf leaders, sign language interpreters, and teachers of the deaf from other islands to gather and participate together. There were 3 benefits that made this training successful. Firstly, this helped Red Cross volunteers understand the needs and barriers of deaf and hard of hearing people and those that they face during emergencies. It was the first time for deaf and hard of hearing leaders to participate and learn about first aid safety and what DRR means. And thirdly, it provided opportunities for deaf and hard of hearing leaders to work together with teachers of the deaf and sign language interpreters on how to improve their interpreting skills for emergency situations. The pilot was very successful, and deaf leaders took the initiative to bring the same kind of training in their home areas to help increase local deaf communities' understanding, to increase their awareness on first aid and DRR, and also to strengthen their community relationships with their local Red Cross and disaster management programs. It also assisted sign language interpreters. So overall, this project through 3 countries resulted in, firstly, 28 DIDRR training sessions for people with disabilities and disability organisations. 2 disability awareness programs distributed to government disaster management and NGOs. And 3, it produced accessible DIDRR resources in multiple formats, including Braille and sign language. increasing the resilience of the deaf community in New South Wales to natural hazards and disasters project. This was a multi-partnered project led by the University of New South Wales. This involved working with a local deaf organisation and the state's emergency services in identifying deaf communities' needs and experiences from past disasters and how access and opportunities could be improved in the future. There were major wins gained out of this project. The first one was having Australian Sign Language interpreters provided on emergency live TV news for the first time in 2013 during the bushfires in the Blue Mountains. And also the Get Ready Deaf Community New South Wales project, an emergency preparedness initiative that was based on a recommendation from the research project. The Get Ready initiative trained deaf and hard of hearing people with skills and knowledge on emergency preparedness, where they became the bridges between deaf community members and emergency services. With regard to emergency information, there was also deaf awareness training for emergency services to increase their awareness on how to work with and assist deaf and hard of hearing people during emergencies. And finally, there was a strengthening of community engagement between deaf organisations and emergency services. At the moment, I'm working on disability inclusion with Fire and Rescue New South Wales, where the work is focused on strengthening community engagements with different disability groups. This involves reaching out to disability organisations, having conversations with them to actually identify their specific needs, because all disability groups are not the same. These conversations assist Fire and Rescue to develop and deliver fire safety education and information messages to complement different disability groups and their needs. One of the activities they're working on is developing fact sheets for firefighters. What this means is that for every consultation with different disability groups, a fact sheet is created that lists general information and access needs for specific disability groups during emergencies. There is also internal training being developed for firefighters on safety visits to ensure that they meet the needs of a person with a disability. Fire and Rescue offer safety visits that include checking and installing smoke alarms in homes and checking around the home and the property to ensure fire safety information on cooking, heaters and open fires, and with regard to electricity, etc. They will also provide advice on a fire escape plan in case a fire happens in your home and how to call emergency services for help. For firefighters going to homes of people with disabilities, there is a need for them to become aware of how to accommodate people with disabilities' access needs during safety visits. Lastly, Fire and Rescue is also working on a fire and safety program for children with disabilities. This involves firefighters attending different schools to educate children with disabilities on fire safety and includes a child-friendly video which is accessible for all to watch. It includes captions, sign language interpreters on screen, audio, and information in plain language that's simple to understand. While disability inclusion may be new for some emergency services, I've listed some of the important challenges and what this means for the future in this space. One of the major challenges is measurement. How do we measure the skills and knowledge of people with disabilities and emergency services that have been trained and then put that into practice. Was it successful or not? That still needs to be determined. Also, training for emergency responders on how to work with families with disabilities, their interpreters, support workers, and during emergencies. This is often one group that people forget when assisting a person with a disability. There may be a third person involved. So emergency responders really need to understand how to work with those people as well. Now, for the future of disability inclusion, there is actually no one best practice for all. I see this more as an ongoing learning experience for everyone that will involve trial and error. There is always room for improvement and a continuing need to update best practice in disability inclusion. Thank you.
Thank you very much, Leila. Thank you very much, Rebecca, for your support during this workshop. We are very, very close to the end of our session. Yeah, I would have a general remark or question to Leila, because I think it's very interesting to have this comparative approach based on your experience in the Philippines and in Australia. So how did you, I mean, what could be the solution that you would recommend to improve search and rescue operation for people with disability, and how is it possible to measure these best practices?
Yes, that's a difficult question. It's definitely a good question, but it's quite difficult to answer. Let me see. I think there's not one solution that fits all. But from a basic perspective, I think for any search and rescue activities and organisations is to consult with disability groups, have conversations with them. That would be the number one. You need to build trust and relationships and collaboration with people with disabilities. And they will feel that they have therefore been effectively included. I think search and rescue has an opportunity to ask and consult with people with disabilities to find the best ways that they can deal with them during emergencies. There are a diversity of countries and people with disabilities and different ways of operation. What we might do here might be different in different countries. What works in other countries might not be suitable for us. So I think it really depends on availability of resources that people have within particular countries. I think it's really great initially if you can contact those disability groups and have conversations with them, as I said before, and to determine what resources work best with them in specific situations and specific contexts. All right, in terms of measurement, that is a challenge. And as I mentioned in my presentation, I think that's something that we still need to explore more. I think the best way to measure is, let's say an emergency happens, and then you need to determine whether it's effective or not. Does it need to be improved? Did it work? So some of those things need to be investigated further.
Thank you, Leila. Thank you, Rebecca. Then I'd just like to take maybe 1 or 2 points, because there were some questions in the chat. Maybe I will take one. One was more related to tools. It was one question to Stefano, also about. I mean, how do you have tool, or do you locate people with disability? Do you do you try to map activity for specific areas or for specific neighborhoods?
Yeah. I have answered to the question. Here in Italy, there are some problems connected with the privacy.
Of course.
We are studying this problem between the protection civil plan. But in this period, we have had a good experience, good experience with the COVID, because in this period we have the name and the address of every person who have the COVID. Because if you have to plan the rescue, you have to know if you have a person with COVID or not COVID. So this era of this COVID era can open some doors in this aspect. But now, I don't know. In these problems, we have some experience made in the south of Italy, and also in Trieste, near Pordenone, near my city, where some people with disability voluntarily represent their necessity to the local local fire department. So the operative room know if a person have one type or another type of disability, but is ever personal suitable.
Yeah, thank you, Stefano, because yeah, I guess that it would be very useful for the rescue team to know, I mean, to have this information, but of course, data protection and right of personal life. I mean, it has to be a personal choice. So thank you for these remarks. We are getting a bit out of time, but I don't know if there are any other questions from the audience. If people want to ask something, it's time now. I do not see any from the audience. We will distribute, of course, all presentation. From what I heard from the different presentation, I think that they are common experience and common lessons that you have all about the human dimension and the need to have the inclusion as a human right to be exercised, and the need also to we didn't have much time to discuss this, but I think that the continuity of the process is very important, because whenever you are raising expectation among different community, you need to have a continuity and keep this in place and continue to improve the procedures, the guidelines, and to build up on experience. So a combination of human and tools as well, and develop a new way of working with a real collaboration with the disability organizations that will help us to make progress. So I would really like to thank you very much for your participation. Thank you, because I see that we had all along almost 270 participants. So it shows that the topic is really relevant for many of us, and that there's still progress to make on sharing experience. So I want to say goodbye to all of you. Thanks a lot for your input. We will share presentation. You will have details of the presenter. So if you have personal questions that were not addressed, there will still be a possibility. So thank you all. I see many signs. So goodbye to everybody, and thank you again for your participation. Thank you. Bye-bye. Bye-bye.
Marie-Christine, on pensait avec Jean, si les gens activent leur photo, faire une capture d'écran.
Ah yes, vous pouvez leur dire.
Ouais. If you want, all of you, you can, before leaving, you can activate your camera, and maybe we can do a screenshot with all of you, so we can put our best smiles. Okay, I will do some